Alright guys, so we're trying to define some terminologies as related to infectious disease control. You know, so I didn't put it out here, but it's actually as related to infectious disease control. So for this, we'll be talking about what it means, what hazard assessment actually means. We'll talk about what exposure assessment means. We'll talk about what context assessment means. So all this just have to do with you trying to quantify risk. You understand? So there's a problem and you are trying to actually check, okay, this problem, is it actually an emergency or is something that I can actually handle bit by bit, you know. So for hazard assessment, we say that it is the identification of a hazard or number of potential hazards, you know. All right, so those are the hazards that are basically causing the event and of associated adverse health effects. So public health hazard can include biological hazards, chemical hazards, physical hazards, radionuclear hazards. Okay, so hazard assessments involve you are trying to identify the hazard that could be causing the event, reviewing key informations about potential hazard. You're trying to characterize them, ranking, so which of the plenty hazard you have found that is considered the possible cause of the event, you know. So the relative likelihood of a hazard can be determined by clinical features and natural history of the disease in humans and animals, timing of the event, and speed at which the various events were unfolding, geographical areas and settings affected, the persons and populations affected. So what is exposure assessment? Exposure assessment, we say that is evaluation of the exposure of the individuals and population to likely hazards, you know. So the key output of the assessment is an estimation. Okay, like you want to estimate number of people or group that have been affected, number of exposed people or group who are likely to now have the disease condition. Information required to answer these questions include things like mode of transmission, how did the disease actually spread from one person to another, dose response, you know, incubation period, how long did this person have it before he started showing symptoms, case fatality rate, estimation of the potential for transmission, vaccine status of the exposed population. So context has assessment now. So context assessment is an evaluation of the environment in which the event is actually taking place. So this may involve you are trying to evaluate the climate, the vegetation, the land use, water systems. You're trying to like say, okay, some of these disease conditions are actually common in this place, you know, common in this place, common in this place. You know, you are trying to also access the like hygiene, you know. So the health of the population, like their nutrition, disease burden, previous outbreaks. What were the previous diseases that were actually occurring here? Is it the same disease coming back, or is a disease actually related to this one coming back? Then you also evaluate the infrastructure of those people, transport links, healthcare, public health infrastructure, their cultural practice, their political will, their beliefs. Okay, so these three things as related to infectious disease outbreaks.